Hello everybody. Well, let's get into how do we live well and what do our feet, our knees, and our joints tell us about our body, what's going on the inside, and lets us know how we can treat it from the outside. The hope that we can address today is a couple different questions. Number one, if your feet, your knees, your joints hurt and there doesn't seem to be some specific reason, there always is a reason, but we might not need to look at that joint as the main problem. That's the number one thing we're going to teach you. Chiropractors are very well versed in musculoskeletal conditions, so how do chiropractors deal with these issues and what can you learn about that? And we're going to hopefully let you know what you can do at home to try to help protect your joints. And we're just going to talk a little bit about some of the aspects of how do you support your joints long term. What can you do to make sure that they age as gracefully as possible with as little pain and dysfunction as possible. So let's talk about some of the numbers. How many people have osteoarthritis of their knee? Well, many people. It's actually doubled since the mid-20th century. We move less than we ever have. Most of us were farmers before the turn of the century. So at this point, we move less. And the fact is that we're not farming. That means that a bunch of farms are making all the food. And that food probably is devoid of a lot of nutrients. So if osteoarthritis is doubling, what are our habits how have they changed? Think about that. 1 in 3 people, 45 and older, are going to show signs of some knee osteoarthritis. So we're talking specifically about your knee. The knee, very commonly, is going to be the end result of a problem, but usually not the cause. There's a lot of factors that cause the knee to start to break down, and we're going to go over these, but typically it's not the root cause. The feet and the hips tend to be the more important part here. Plantar fasciitis is one of the most common causes of foot pain in adults, and this can lead to knee issues very often. Let's look at the foot and the knee. Obviously, you could have an injury. A lot of times in my office, I find that people who have chronic injuries, strains and sprains, and even injuries that seemed like it was due to another player on a soccer field or a football field, it seems to happen on specific sides. And a lot of that is because there's an inborn weakness or imbalance in certain sides that makes it more likely to be an MCL injury, ACL injury, sprained ankles. You know, say, well, I had an injury. What caused that injury could have been mechanics, and that's what we're going to get into. Even if someone came from the side and hit you, that is still less common of the issues that most people have. It's usually due to chronic wear and tear, and then they did some movement that they called was the injury. But the injury was building up over time. Arthritis can cause pain, but that is just again, it's letting us know that your body has been under stress and strain and misalignment for a long time, so it's built up arthritis. Arthritis doesn't just happen because you're getting older. Like, oh, it's the arthritis time, it's coming. That's because your body has been in an abnormal position and it's been possibly injured or locked together and not moving properly. So your body starts to prevent movement by forming arthritis. It's your body's natural response to try to help prevent problems. So if arthritis is there, that means you've had problems for decades, typically. When people gain weight, that puts extra stress on the joints. Many studies have shown just a 10% loss of weight can reduce pain by up to 50%. So it doesn't take much to even take off some of that weight, which means that even a slight gain in weight can start to cause more symptoms for people. And that's just the extra amount of pressure and abnormal stress and strain on the joints. So there's another reason that we look at the whole body and help with nutrition as well as movement, right? Improper footwear can definitely be a culprit, or the fact that we're not changing our footwear out soon enough. Many people come into my office and their shoes look like they have 100,000 miles on them. They're not a Honda car, all right? They can't just keep going. Your shoes have a certain lifespan of steps, and they're going to wear out fast. Even shoes that could look okay on the outside could have broken down on the mechanics on the inside that absorb shock and support your arches. Some of the simplest things is changing footwear more often. Bursitis, tendonitis, those are conditions that are definitely caused by inflammation. That basically is telling us that you're rubbing, you're stretching, you're straining tissues in your body or your foot or your knee that are now becoming inflamed or irritated because they're not working in the most proper position. When you have a misalignment in that joint, wear and tear is going to start to cause inflammation. So these arthritis and bursitis is the body just saying, hey, I don't have level pressure and you're putting too much stress on me too often. That could be because of the way you sit and you stand. Maybe you work out. Maybe you sit in a certain way. Maybe you work at work in the same position, but it's wear and tear on an abnormal position. Mechanical problems is the biggest issue that we see. Basically, this is a chain. You have a kinetic chain. If your ankle is affected, your knee's affected, your hips are affected, and all the way up to even your head, if you can believe that. So your nerves are going to be very sensitive to many things. And your nerves are sending all these signals back to your brain. If your brain's not getting the proper signals, or the brain has now just got used to this abnormal movement, it may think it's normal and not try to correct it. That's why we adjust people. This is why you do rehab. This is why you retrain things. things, to reset that brain and body. Chiropractic is very simply about connection. Your brain and your body. Your body's all connected. It's called a kinetic chain. Your spine, your pelvis, your hips, your knee, your ankle, and your foot, they all work together. If I were to take your big toe joint and I was to restrict it, not allow it to move, you would still walk if you had to, but you would compensate. And that's just one joint. Think there's so many joints in your foot that could be stuck. That's why we adjust the foot a lot. One restriction of one of those joints could long term, even just a sprain of an ankle they found in surgery, lead to disc problems later on in life because the mechanics are off. You're connected everywhere. So one joint pain is often a symptom of a problem that's somewhere else in that chain. Why is it so important that we worry about misalignments? Because misalignments, which usually cause restriction in movement, ultimately lead to arthritis. These restrictions are going to start to cause probably stress and strain and pressure of tendons and muscles, which usually brings people into the office, or maybe they just massage it. Maybe they just get some ibuprofen. But the fact is those are starting to tell us that there's stress and strain and pressure in that area. If we work past that, or the body goes, well, I guess we're just gonna ignore this pain, just kind of like your clothes. If you wear them long, your body doesn't know you're wearing clothes. If your body's dysfunctioning enough, your brain's gonna stop telling you about it. So it just shuts that channel off. That part of the brain kind of tunes out, and that then starts to lead to more dysfunction, which can lead to arthritis. So there's stress and strain and pressure then on the joint itself, and the joint itself starts to wear and tear, and the body's response to abnormal motion is to build arthritis. It's just going to lock it down, and it happens in your spine a lot too. So these small imbalances compound over time, and then they start to maybe lead to something that, oh, I think I got a problem. Your problem started decades ago. How do chiropractors really deal with joint pain? Well, the majority of the literature found that chiropractic benefits patients with many of these problems that aren't related to the spine. It comes to the hips or knees and the ankles and foot conditions. Care isn't just limited to the spine because we are experts in the whole body. We can adjust and manipulate and understand what things you may need to do to start to change the mechanics. And if we don't have all the solutions, we can definitely direct you where you would go next rather than just kind of ignoring that problem or just injecting it with a cortisone, right? Let's try to fix the cause. Chiropractic care is very conservative, which the benefit here is that there's less risk and we're going to get to the root of that a little bit better. And if it's not working, it helps you know that we've worked past what the body can handle and now we have to go to the next steps rather than going to the next steps and then coming backwards. That makes it harder. This is the you're crooked man posture here. The one you're looking at on the left is very possible how your whole body can be affected by just a rolling in of your ankle. If your ankle's pronated, which means that if you stood in the mirror and you see that your one inside ankle bone or malleolus is rotated closer to the ground than the other one, then you've got a problem in the sense that one foot is pronating or rolling in more. You have a flatter arch on one side. If you have that on the left, that's what this is showing you. What could happen? Well, the knee's going to have a medial stress, which people might strain their MCL. They might have meniscus problems on the inside. They might even have bursitis and other issues with the knee. Their hip then is going to jam on the right side. As you can kind of tell, it kind of rolls in and then flips up. Then you might have back issues and hip tension on the opposite side. The shoulders are typically going to try to rebound or compensate to the fact that the hip's high, so then the shoulders go low, and now your head's tilting back to the other direction. Your head's always trying to stay level. So you could have headaches due to your foot rolling in. This is that kinetic chain. This is the understanding. When your body's in symmetry and balanced, like the person on the right, your body has a lot less stress taken away. And if this is coming from your feet, for example, this is why we prescribe a lot of what we call foot levelers or orthotics, because many people have an abnormal difference side to side. They have an imbalance. And if we can correct that, we can take some of the chronic stress of every motion, every step out of your body. Of course, if you have inflammation and joint breakdown, there are definitely good supplements that you should be taking rather than just ibuprofen to help rebuild the tissue and prevent it from being inflamed. Medical treatments can be an option and may need to if there's things that are beyond the ability for the body to heal. But the key first is to try to prevent some of these issues from coming on. And that comes with balance and symmetry. The big thing is kind of things that we can do at home. Let's go through some of those things, to help you protect things. You want to move often. We like to say that we want to help you guys move well and move often. Overdoing it is very possible, especially if you have a lot of bad mechanics. So some people, they may need to move their joints, hips and knees and ankles, with a bike or in the pool or an elliptical versus just walking because their mechanics are so bad that is putting more gravitational stress on them at the first. Movement breaks every 30 to 60 minutes is huge. So if you do end up sitting and you think, well, I'm not on my feet, sitting distorts the hip muscles It shortens some of the muscles in your legs, and your feet aren't being stretched out. So I'm telling you, you go to stand up and move and you think, well, I haven't put pressure on them. Your body is not ready to move if you haven't been moving. So getting up often is very important. Circles at your ankles, your calf stretches are huge. Circles is huge in your ankle, and actually even just putting your big toe kind of on the ground and rolling around on your big toe like it's a pivot. But if you're pivoting all the way around your foot, clockwise and counterclockwise, you're probably moving all of those joints in your foot and in your ankle. Hip openers, those are very simple, but you could be on all fours in doing this, or you could just be standing, but you're basically just trying to open your hip up. You're trying to bring your knee out so that you're kind of making a figure four and opening those up. These are little things you could do every hour just to move your feet and your ankles and hips around. Motion nourishes your joints. Motion helps to get nutrition from your body into your joints and into the tissues that need it. If you have great nutrition but you don't move, you're not getting the benefit of all the good nutrients because they're not getting to the tissues in the way God intended. So movement is life. You want to nourish and help those joints. It's kind of like lubricating, like oil. If you have a rusty joint and you spray it with some WD-40 but you don't move it, it doesn't really do much. You got to move that joint, that rusty hinge, in order for that oil to get inside. Your body produces this oil. Fish oil is a great thing to take. It's one of the most simple anti-inflammatory products on the market and anti-arthritic products because it helps to lubricate. It's oil. That's what it's for. And so just keeping hydrated as well. But when you're still, things start to decay. And in 2 weeks, if your body's locked up in any joint, if in 2 weeks we took a microscope and looked at the surface of that cartilage, it will start to show breakdown in arthritic changes in 2 weeks of not moving it. This is why you get checked often. We talked about footwear, I think, a lot, matter a ton. You're not looking just for soft, comfortable shoes, you're looking for supportive shoes. What I would tell people right now is probably that go to a store that's probably gonna give you a little more attention and help you to try to pick out shoes that fit you and your body. I think right here locally, the Lucky Shoes do really good at that. The Second Soul is a running store, but they do pretty good at that. I think you could buy stuff online as long as there's return policies and things. There's plenty of shoes that I think even let you wear them, and then if you don't like them, you can return them. So look for those things. You need shoes that fit you well. I don't have a great, saying, hey, this shoe or that shoe. I think you gotta find what fits your body right. To me, getting the orthotics makes it a lot better because you could take a shoe that might not have all the best, but those orthotics are going to take up a lot of the bulk of the problem. Rotating shoes is not a bad idea. Making sure, like I said, you look and find out how many miles are these shoes built for, for how long, because you might want to change them out sooner, not just till they look like the foot, your toes breaking through or the rubber's totally gone on the outside. That's way too long, all right? Even your head position, bad posture will affect your hips and knees and ankles. Your body follows your head. And if your body has a head forward and you stand up and your body's moving forward, you're putting stress on different joints in an abnormal way. So just watch your everyday body mechanics. You may lean to one side when you're on a desk. You may lean forward. You may always cross your legs in one direction and have them crossed. Those mechanics start to wear your body every day. Again, this is always just say, get the movement breaks. Get up and move. At least you're rebooting what's going on. But keep your core engaged while you're lifting, when you're sitting too. Avoid locking out your knees. You want to kind of keep them in a slightly bent position when you're lifting. But just being aware of your body, just being aware is one of the biggest things we like to teach around here too. Just listening to your body. Our nutritionist is going to be probably your best bet. I mean, you can talk to me and say, I can give you some this for that kinds of things. But Brian Foltz, who's in here, he's going to be your best bet to try to really look deep into understanding, do you need supplements? Which supplements are the best to start with? Because you may think you just want something for pain, but the pain is probably coming from some other dysfunction in your whole body. Maybe your kidneys aren't clearing things properly. Maybe your gut is inflamed. Maybe your liver isn't processing out all the inflammation, and so that needs support. There's so many reasons you could hurt that aren't just this pill for this, all right? That's medicine. To really understand supplementation is working at the root of where the deficiencies are or the dysfunctions in your body. So definitely think of that. This assessment can help you to understand, what should I start looking at? What do I need to start to do? If you find that you're always favoring one side of your body, telling you that your body's making adaptations without you realizing it. How do you know that in our office? We put you on 2 scales and you'll know if you're favoring one side without knowing it. If your body gets better, the pain gets better with movement, that's usually telling us that there is some inflammatory arthritis, that when you move, your body gets more blood to that area. Again, movement is life, but it gets rid of that inflammation. So if you've been sleeping or you've been sitting and you go to move, that's telling you that joint is building up arthritis. We got to figure out why that is. If your shoes are more than 6 to 8 months old, or just flip them over, look at their wear patterns. If the bottoms of the shoes don't look the same side to side, you've definitely got a problem. There is some imbalance in your gait, and those things are going to start to wear and tear your body big time. Take this assessment, ask yourself, what do I need to do to make some of these changes? Let us know if you have any questions. You can email us, text us, ask any questions that way, and we can address them when you come into your appointment. You guys have a good night.